Question 1. Which of the following actions most effectively reduces the transmission of multi-drug-resistant organisms, MDROs, in healthcare settings, particularly during patient transfers between departments? A. Wearing gloves during all patient interactions. B. Performing hand hygiene before and after patient contact. C. Using contact precautions only when patients are symptomatic. D. Ensuring patient isolation at all times, regardless of condition. Answer: B. Performing hand hygiene before and after patient contact. Rationale: the most effective strategy to reduce MDRO transmission, especially during transfers, is performing hand hygiene. While gloves and isolation are important, hand hygiene significantly lowers the risk of pathogen transmission. Question 2. A nurse is preparing to care for a patient who is in a negative pressure isolation room due to suspected tuberculosis, TB. Which of the following actions is the nurse's priority when entering the room? A. Don a surgical mask and gloves. B. Verify that the room's ventilation system is functional and closed. C. Clean the surfaces with an alcohol-based disinfectant before entering. D. Place a mask on the patient to prevent airborne transmission. Answer: B. Verify that the room's ventilation system is functional and closed. Rationale: the priority action is ensuring the negative pressure room is properly ventilated to contain airborne particles. While PPE is crucial, ventilation is the first line of defense in preventing the spread of TB. Question 3. What is the recommended method for cleaning and disinfecting reusable medical equipment, such as a bronchoscope, to prevent cross-contamination between patients? A. Wash with soap and water, then dry thoroughly. B. Disinfect with a broad-spectrum disinfectant and allow air drying. C. Perform high-level disinfection using an FDA-approved chemical disinfectant or autoclave. D. Wipe the surface with alcohol pads and store in a sterile container. Answer: C. Perform high-level disinfection using an FDA-approved chemical disinfectant or autoclave. Rationale: high-level disinfection is the most effective method for cleaning medical equipment that comes into contact with mucous membranes or sterile areas. Autoclaving or FDA-approved chemical disinfectants are the most reliable methods for ensuring safety. Question 4. In a high-risk neonatal ICU setting, when should a nurse implement alcohol-based hand rub versus soap and water to prevent infection transmission? A. Always use soap and water, regardless of visible contamination. B. Alcohol-based hand rub can be used unless hands are visibly soiled. C. Use alcohol-based hand rub for all patient interactions, even when soiled. D. Soap and water should be used only for surgical procedures. Answer: B. Alcohol-based hand rub can be used unless hands are visibly soiled. Rationale: alcohol-based hand rub is an effective alternative to soap and water unless hands are visibly soiled. In such cases, soap and water should be used for thorough cleaning. Question 5. In the context of infection control, what is the most effective approach for preventing transmission of healthcare-associated infections, HAIs, among patients undergoing surgery? A. Administer prophylactic antibiotics to all surgical patients. B. Utilize strict aseptic techniques during invasive procedures and apply preoperative chlorhexidine washes. C. Isolate patients post-surgery in separate rooms to avoid contamination. D. Provide all surgical patients with a broad-spectrum antimicrobial regimen post-operatively. Answer: B. Utilize strict aseptic techniques during invasive procedures and apply preoperative chlorhexidine washes. Rationale: the use of aseptic techniques during surgery and preoperative chlorhexidine washes is proven to significantly reduce the risk of HAIs. Antibiotics should be used selectively and are not the primary method for preventing infections. Question 6. Which of the following is the most effective strategy for managing the spread of Clostridium difficile, C. diff, in a hospital ward? A. Using hand sanitizers between patient contacts. B. Disinfecting surfaces with bleach-based cleaners and ensuring proper PPE use. C. Placing all patients in isolation regardless of symptoms. D. Administering antibiotics to all patients in the ward as a preventive measure. Answer. B. Disinfecting surfaces with bleach-based cleaners and ensuring proper PPE use. Rationale. C. diff spores are resistant to alcohol-based sanitizers, so bleach-based disinfectants and proper PPE are essential to prevent its spread. Antibiotics should be reserved for treatment, not prevention. Question 7. When caring for a patient with a suspected viral hemorrhagic fever, VHF, which infection control protocol is the nurse's primary focus to prevent transmission to others? A. Standard precautions and routine use of surgical masks. B. Implementing airborne, droplet, and contact precautions simultaneously. C. Using only isolation rooms without additional protective equipment. D. Applying hand hygiene exclusively after handling bodily fluids. Answer. B. Implementing airborne, droplet, and contact precautions simultaneously. Rationale. VHF requires a combination of airborne, droplet, and contact precautions due to its potential for transmission through multiple routes. Standard precautions and surgical masks alone are not sufficient for effective containment. Question 8. What is the key factor in ensuring the safety and effectiveness of a nurse's personal protective equipment, PPE, during an outbreak of an airborne disease like influenza? A. PPE should be worn only during direct patient care. B. PPE should be discarded immediately after one patient interaction, even if not visibly contaminated. C. PPE should be used consistently and correctly throughout patient care, ensuring proper donning and doffing. D. Only masks are needed for airborne diseases, as gloves are unnecessary. Answer. C. PPE should be used consistently and correctly throughout patient care, ensuring proper donning and doffing. Rationale. The key to PPE effectiveness is consistent and correct use. Proper donning and doffing techniques, especially during airborne disease outbreaks, are essential to preventing contamination. Question 9. What is the recommended action when a nurse is exposed to blood or body fluids during patient care, particularly in the case of a known infectious disease like HIV? A. Report the incident immediately, clean the wound, and seek post-exposure prophylaxis, PEP. B. Immediately cleanse the site and resume patient care. C. Wait for symptoms to appear before seeking medical attention. D. Only seek treatment if the patient is symptomatic. Answer. A. Report the incident immediately, clean the wound, and seek post-exposure prophylaxis, PEP. Rationale. Immediate reporting and seeking medical attention, including PEP, are critical after exposure to blood or body fluids to prevent the transmission of infectious diseases like HIV. Question 10. In a hospital setting, what is the most effective strategy for preventing surgical site infections, SSIs, in patients undergoing elective surgery? A. Administering a broad-spectrum antibiotic to all patients before surgery. B. Ensuring strict aseptic technique during surgery and using appropriate antimicrobial prophylaxis based on surgical risk. C. Isolating all postoperative patients in private rooms. D. Using a closed surgical dressing for all surgeries, regardless of the patient's condition. Answer. B. Ensuring strict aseptic technique during surgery and using appropriate antimicrobial prophylaxis based on surgical risk. Rationale. Strict aseptic technique and appropriate antimicrobial prophylaxis tailored to the patient's surgical risk are the most effective ways to prevent SSIs. Broad-spectrum antibiotics and isolation are less specific and not always necessary. Question 11. Which of the following methods is the most effective for controlling the spread of carbapenem-resistant enterobacteriaceae, CRE, in an ICU setting? A. Isolating all patients with healthcare-associated infections, HEIs. B. Implementing contact precautions for all patients, regardless of symptoms. C. Using enhanced environmental cleaning and restricting antibiotic use. D. Administering broad-spectrum antibiotics to all patients to prevent infection. Answer: C. Using enhanced environmental cleaning and restricting antibiotic use. Rationale: CRE are highly resistant to antibiotics, so restricting unnecessary antibiotic use, coupled with enhanced cleaning practices, is the most effective strategy. Isolation and contact precautions are important, but are not sufficient alone. Question 12. In the management of a patient with suspected viral influenza, which of the following infection control measures is the priority to prevent nosocomial transmission? A. Isolate the patient in a private room and apply droplet precautions. B. Administer antiviral medication within the first 24 hours. C. Implement airborne precautions to prevent aerosol spread. D. Use only gloves and gowns for contact with contaminated surfaces. Answer: A. Isolate the patient in a private room and apply droplet precautions. Rationale: influenza is transmitted via respiratory droplets, so isolation in a private room and droplet precautions, mask, gloves, are critical to prevent transmission to others. Airborne precautions are not required for influenza. Question 13. What is the most important infection control practice for preventing Clostridium difficile, C. diff, transmission in a hospital setting? A. Use alcohol-based hand rub after patient contact. B. Perform hand hygiene with soap and water and disinfect surfaces with bleach-based cleaners. C. Administer routine antibiotics to all high-risk patients. D. Isolate patients with C. diff and use surgical masks in all interactions. Answer: B. Perform hand hygiene with soap and water and disinfect surfaces with bleach-based cleaners. Rationale: C. diff spores are not effectively killed by alcohol-based hand rubs. Soap and water for hand hygiene and bleach-based cleaners for environmental disinfection are key to preventing its spread. Question 14. When managing a patient with suspected meningococcal meningitis, which of the following infection control measures should be prioritized during the first 24 hours of treatment? A. Airborne precautions and N95 respirators for all healthcare workers. B. Droplet precautions, including mask, gown, and gloves for all patient interactions. C. Standard precautions with only a surgical mask. D. No precautions needed as meningococcal infection is not easily transmissible. Answer: B. Droplet precautions, including mask, gown, and gloves for all patient interactions. Rationale: meningococcal meningitis is transmitted through respiratory droplets. During the first 24 hours of antibiotic treatment, droplet precautions should be used to minimize transmission. Question 15. A nurse is caring for a patient who is undergoing chemotherapy and has developed neutropenic fever. Which of the following infection control strategies should be used to prevent the spread of infection to other patients in the same ward? A. Place the patient in a private room and initiate standard precautions only. B. Place the patient in a private room with protective isolation, use a surgical mask for visitors, and implement strict hand hygiene. C. Isolate the patient in a negative pressure room to prevent airborne transmission. D. Encourage the patient to wear a mask when leaving the room for testing. Answer: B. Place the patient in a private room with protective isolation, use a surgical mask for visitors, and implement strict hand hygiene. Rationale: Patients with neutropenic fever are highly susceptible to infections. Protective isolation, including visitor restrictions, surgical masks, and hand hygiene, is essential to minimize the risk of infection transmission. Question 16. What is the primary strategy to prevent healthcare-associated infections, HAIs, caused by vancomycin-resistant enterococcus, VRE, in long-term care facilities? A. Provide all patients with antibiotic prophylaxis. B. Use contact precautions for all patients regardless of symptoms. C. Perform active surveillance and ensure rigorous hand hygiene and environmental cleaning. D. Implement only hand hygiene protocols, as no other measures are effective. Answer. C. Perform active surveillance and ensure rigorous hand hygiene and environmental cleaning. Rationale. Active surveillance and rigorous cleaning help identify and reduce the spread of VRE. Hand hygiene alone is insufficient without comprehensive environmental cleaning and proper isolation precautions. Question 17. When a nurse notices an increased incidence of methicillin-resistant Staphylococcus aureus, MRSA, infections on a specific ward, what is the most effective first step in controlling the outbreak? A. Start universal MRSA screening for all patients on the ward. B. Implement contact precautions for all patients and initiate antibiotic stewardship. C. Administer antibiotics to all patients on the ward as a preventive measure. D. Discontinue hand hygiene and cleaning protocols as MRSA is already present. Answer. B. Implement contact precautions for all patients and initiate antibiotic stewardship. Rationale. In an outbreak of MRSA, implementing contact precautions for all patients and ensuring proper antibiotic stewardship are crucial. Screening and preventive antibiotics are secondary measures. Question 18. In an outpatient setting, how can the spread of respiratory infections like COVID-19 best be minimized among healthcare workers and patients? A. Ensure that all healthcare workers wear gloves and gowns during patient interactions. B. Screen all patients for symptoms and ensure healthcare workers wear a surgical mask and eye protection. C. Isolate patients with respiratory symptoms in a separate waiting room. D. Provide all patients with an antiviral medication upon entry. Answer. B. Screen all patients for symptoms and ensure healthcare workers wear a surgical mask and eye protection. Rationale. Screening for symptoms and using masks and eye protection effectively reduce the risk of airborne and droplet transmission in outpatient settings, especially for respiratory infections like COVID-19. Question 19. Which of the following infection control protocols should a nurse follow when handling specimens that are suspected of containing bloodborne pathogens, such as HIV or hepatitis B? A. Wear gloves and goggles, but no gown is needed. B. Use standard precautions, including gloves and a gown, with careful handling and disposal. C. Wear a surgical mask and goggles, but no gloves are necessary. D. Only gloves are required when handling specimens, and no other precautions are necessary. Answer. B. Use standard precautions, including gloves and a gown, with careful handling and disposal. Rationale. Standard precautions, including gloves, gowns, and careful handling, are essential for preventing exposure to bloodborne pathogens. Goggles are also important to protect the eyes. Question 20. When managing a suspected outbreak of norovirus in a hospital, which of the following actions is most important to contain the spread of infection among patients and staff? A. Isolate all affected patients and apply contact precautions. B. Use a combination of isolation, contact precautions, and environmental cleaning with chlorine bleach. C. Administer antivirals to patients immediately after diagnosis. D. Increase the number of staff members to care for affected patients. Answer. B. Use a combination of isolation, contact precautions, and environmental cleaning with chlorine bleach. Rationale: norovirus is highly contagious and resistant to many disinfectants. The most effective containment strategy involves isolation, contact precautions, and thorough environmental cleaning with chlorine bleach. Question 21. In the context of infection control, what is the most important action when handling a patient with a multi-drug-resistant tuberculosis, MDR-TB, infection in an emergency department? A. Initiate airborne precautions and provide a N95 mask for the patient. B. Administer a second-line anti-TB drug regimen before diagnostic confirmation. C. Perform a full-body wash of the patient before any procedures. D. Place the patient in a private room and implement contact precautions only. Answer: A. Initiate airborne precautions and provide a N95 mask for the patient. Rationale: MDR-TB is transmitted through airborne droplets, so airborne precautions with a N95 mask for both the patient and healthcare workers are crucial. Contact precautions alone would not be sufficient. Question 22. What is the best method for preventing the spread of vancomycin-resistant enterococci VRE in a neonatal intensive care unit NICU? A. Use only disposable equipment and discard after each patient use. B. Perform routine surveillance cultures for all infants admitted to the NICU. C. Implement contact precautions for all infants in the NICU, regardless of symptoms. D. Administer vancomycin prophylactically to all infants in the NICU. Answer: C. Implement contact precautions for all infants in the NICU, regardless of symptoms. Rationale: VRE can be transmitted through direct contact, so implementing contact precautions for all infants is the best strategy to prevent its spread, even if the patient is not showing symptoms. Question 23. A nurse is caring for a patient with a central venous catheter, CVC, who develops a fever and positive blood cultures for Staphylococcus aureus. Which of the following is the most appropriate infection control response? A. Place the patient on isolation precautions and remove the catheter immediately. B. Begin antibiotics and remove the catheter only if the patient's fever persists. C. Place the patient in a private room and administer antibiotics, leaving the catheter in place. D. Apply contact precautions and change the catheter dressing daily. Answer: A. Place the patient on isolation precautions and remove the catheter immediately. Rationale: when a patient with a CVC develops a bloodstream infection, the catheter should be removed to prevent further complications. Isolation precautions help prevent transmission to others. Question 24. What is the recommended infection control protocol for managing a patient with suspected Ebola virus disease, EVD, in a hospital setting? A. Apply droplet precautions and a surgical mask for all interactions. B. Isolate the patient in a negative pressure room and use full PPE, including gloves, gown, mask, and face shield. C. Use standard precautions and allow the patient to leave the room if needed. D. Administer antiviral treatment immediately and place the patient in a shared room. Answer: B. Isolate the patient in a negative pressure room and use full PPE, including gloves, gown, mask, and face shield. Rationale: Ebola is transmitted through direct contact with bodily fluids, so negative pressure isolation and full PPE are necessary to protect healthcare workers and prevent transmission. Question 25. In a hospital outbreak of norovirus, which of the following actions is most critical in preventing the spread of infection to other patients and staff? A. Implement airborne precautions for all patients in the ward. B. Enforce strict hand hygiene and isolation of symptomatic patients in private rooms. C. Provide antiviral medication to all patients in the ward. D. Isolate patients in negative pressure rooms and restrict visitor access. Answer: B. Enforce strict hand hygiene and isolation of symptomatic patients in private rooms. Rationale: norovirus is highly contagious and spread through the fecal-oral route. Strict hand hygiene, isolation of symptomatic patients, and limiting patient movement are critical to preventing its transmission. Question 26. In preventing the spread of methicillin-resistant Staphylococcus aureus, MRSA, in a hospital's surgical unit, which of the following practices should be implemented for all patients undergoing elective surgery? A. Use gloves and gowns for all staff, but no masks. B. Perform preoperative screening for MRSA and decolonize carriers with mupirocin nasal ointment. C. Place all patients in isolation rooms and restrict visitors. D. Only use antibiotics postoperatively for patients with a history of MRSA. Answer: B. Perform preoperative screening for MRSA and decolonize carriers with mupirocin nasal ointment. Rationale: preoperative MRSA screening and decolonization are essential to reduce the risk of surgical site infections. Isolation and antibiotics are not as effective as screening and decolonization. Question 27. What is the most effective infection control strategy for a hospital experiencing an outbreak of influenza, particularly during peak flu season? A. Administer seasonal influenza vaccines to all staff and patients. B. Use droplet precautions for all patients with respiratory symptoms and provide masks for healthcare workers. C. Place all patients with respiratory symptoms in negative pressure isolation rooms. D. Limit all patient visitation to reduce exposure to the flu virus. Answer: B. Use droplet precautions for all patients with respiratory symptoms and provide masks for healthcare workers. Rationale: influenza is primarily transmitted through droplets, so using droplet precautions and ensuring healthcare workers wear masks significantly reduces transmission. Vaccination, while important, is only effective when done in advance. Question 28. A nurse is caring for a patient with suspected pneumonic plague. Which of the following infection control measures is most critical to prevent transmission? A. Contact precautions with gloves and gown. B. Droplet precautions and N95 respirators for healthcare workers. C. Airborne precautions with negative pressure room and full PPE. D. Universal precautions with hand hygiene only. Answer: B. Droplet precautions and N95 respirators for healthcare workers. Rationale: pneumonic plague is transmitted via respiratory droplets, requiring droplet precautions and N95 respirators. Airborne precautions are not necessary unless the patient has aerosolized the bacteria. Question 29. Which infection control measure should be used when handling biological waste contaminated with a highly contagious virus, such as smallpox? A. Regular trash disposal and environmental cleaning. B. Use of red biohazard bags, gloves, gowns, and proper disposal procedures. C. Disinfection with alcohol-based sanitizers. D. Isolate the waste in a separate room and wait for virus decay. Answer: B. Use of red biohazard bags, gloves, gowns, and proper disposal procedures. Rationale: contaminated biological waste, particularly with highly contagious viruses like smallpox, requires the use of red biohazard bags and proper PPE to prevent the virus from spreading through improper handling or disposal. Question 30. In the management of an outbreak of antibiotic-resistant Acinetobacter baumannii in a long-term care facility, which of the following infection control strategies should be prioritized? A. Initiate airborne precautions for all patients in the facility. B. Restrict all visitors and implement strict hand hygiene and contact precautions. C. Administer broad-spectrum antibiotics to all residents to prevent infection. D. Place all patients on contact precautions without screening. Answer: B. Restrict all visitors and implement strict hand hygiene and contact precautions. Rationale: Acinetobacter baumannii is resistant to many antibiotics, so the most effective control measure is strict hand hygiene, contact precautions, and visitor restrictions to limit transmission. Antibiotic administration to all residents is not recommended. Question 31. When managing an outbreak of Zika virus in a hospital, which infection control strategy is most crucial for preventing vector transmission within the healthcare environment? A. Administering antiviral drugs to all affected patients. B. Ensuring proper insecticide use in patient rooms and surrounding areas. C. Placing patients in isolation rooms with negative airflow. D. Using mosquito nets on all beds to prevent mosquito contact. Answer: B. Ensuring proper insecticide use in patient rooms and surrounding areas. Rationale: Zika virus is primarily transmitted by mosquitoes. The most effective control measure is ensuring proper insecticide use to eliminate vectors, especially in healthcare settings where patients may be more vulnerable. Question 32. A nurse is caring for a patient with severe sepsis caused by a drug-resistant pathogen. Which infection control measure should be implemented first to protect other patients in the ICU? A. Administer antibiotics and wait for results of blood cultures. B. Place the patient in a private room and initiate contact and droplet precautions. C. Begin broad-spectrum antibiotics and discontinue any invasive devices. D. Isolate the patient in a negative pressure room and use full PPE. Answer: B. Place the patient in a private room and initiate contact and droplet precautions. Rationale: Sepsis caused by a drug-resistant pathogen requires isolation to prevent the spread of infection. Contact and droplet precautions are essential for preventing transmission to other patients, even if a specific pathogen has not been identified. Question 33. What is the most effective method to reduce the spread of human immunodeficiency virus (HIV) in a hospital setting during invasive procedures? A. Use a double-layered surgical gown and gloves. B. Always use sterile techniques and ensure proper handling and disposal of needles and sharp objects. C. Administer post-exposure prophylaxis (PEP) to all patients after surgery. D. Place all patients in protective isolation after surgery. Answer: B. Always use sterile techniques and ensure proper handling and disposal of needles and sharp objects. Rationale: Sterile techniques and proper handling and disposal of sharps are essential to prevent occupational exposure to HIV and other bloodborne pathogens. PEP is important post-exposure, but does not replace proper infection control during procedures. Question 34. In a hospital outbreak of hepatitis C virus, HCV, which infection control measure is most effective in minimizing the risk of transmission to healthcare workers? A. Administer hepatitis C vaccines to all healthcare workers. B. Use needleless systems and implement strict hand hygiene protocols. C. Apply standard precautions only when interacting with patients diagnosed with HCV. D. Isolate all HCV-positive patients in private rooms and restrict visitors. Answer: B. Use needleless systems and implement strict hand hygiene protocols. Rationale: HCV is primarily transmitted through blood, so using needleless systems along with strict hand hygiene reduces the risk of transmission. Vaccination is not available for HCV, and isolation is not necessary unless there is an additional infection risk. Question 35. A nurse is caring for a patient with pneumocystis pneumonia, PCP, who is immunocompromised. Which infection control measure is most important to prevent transmission to other patients? A. Administer antifungal treatment and place the patient in a private room with a closed door. B. Apply airborne precautions, including N95 respirators for healthcare workers. C. Isolate the patient in a negative pressure room and administer oxygen therapy. D. Use contact precautions and provide a surgical mask for the patient during transport. Answer: B. Apply airborne precautions, including N95 respirators for healthcare workers. Rationale: PCP is caused by a fungal infection that can be transmitted via airborne particles. Airborne precautions with N95 respirators are essential, as well as isolating the patient in a private room with proper ventilation. Question 36. What is the most effective strategy to control an outbreak of Legionella in a hospital's water system? A. Flushing water systems with bleach and chlorinating the entire hospital plumbing. B. Cleaning and disinfecting cooling towers and water tanks using heat or chemical treatments. C. Installing UV lights in all water fixtures to kill bacteria. D. Restricting water use in the hospital for all patients until the outbreak is contained. Answer: B. Cleaning and disinfecting cooling towers and water tanks using heat or chemical treatments. Rationale: Legionella bacteria thrive in warm water environments like cooling towers and water tanks. Cleaning and disinfecting these systems with heat or chemicals is the most effective strategy for controlling outbreaks. Question 37. During a suspected outbreak of H1N1 influenza in a pediatric ward, which of the following infection control measures should be implemented immediately? A. Place all patients in isolation rooms with negative pressure. B. Administer antiviral medications to all patients and staff. C. Implement droplet precautions for all patients with respiratory symptoms and provide surgical masks. D. Screen all patients for symptoms and admit only those with severe illness. Answer: C. Implement droplet precautions for all patients with respiratory symptoms and provide surgical masks. Rationale: H1N1 influenza spreads through respiratory droplets, so droplet precautions, including surgical masks for healthcare workers, are essential for controlling the spread. Isolation rooms and antiviral medications are useful, but not as immediate and broadly applicable as droplet precautions. Question 38. In the event of an outbreak of listeriosis linked to contaminated food in a hospital, which infection control measure should be prioritized? A. Place all food handling staff in quarantine to prevent further contamination. B. Remove contaminated food from the facility and immediately notify public health authorities. C. Administer antibiotics to all patients to prevent infection. D. Isolate patients showing symptoms and provide supportive care only. Answer: B. Remove contaminated food from the facility and immediately notify public health authorities. Rationale: The immediate priority in a foodborne outbreak is to remove the contaminated food and alert public health authorities for investigation. Antibiotics are not always necessary for all patients, and isolation should be done for symptomatic patients. Question 39. What is the most effective way to prevent the spread of vancomycin-resistant enterococcus, VRE, in a hospital's high-risk surgical unit? A. Administer a single dose of vancomycin to all patients undergoing surgery. B. Screen all patients preoperatively for VRE and use contact precautions for positive cases. C. Place all patients in a negative pressure room during surgery. D. Isolate patients diagnosed with VRE for the duration of their hospital stay. Answer: B. Screen all patients preoperatively for VRE and use contact precautions for positive cases. Rationale: Screening for VRE and using contact precautions for carriers is the most effective strategy to prevent the spread of VRE in high-risk surgical units. Preoperative screening allows for targeted interventions. Question 40. A nurse is caring for a patient who has just been diagnosed with methicillin-resistant Staphylococcus aureus, MRSA, in a wound. What is the most important infection control measure to prevent MRSA transmission to other patients? A. Initiate contact precautions and ensure thorough cleaning of all surfaces. B. Administer systemic antibiotics to all patients in the unit as a preventive measure. C. Isolate the patient in a negative pressure room to control airborne transmission. D. Only wear gloves while changing the patient's dressing and disinfect surfaces weekly. Answer: A. Initiate contact precautions and ensure thorough cleaning of all surfaces. Rationale: MRSA is primarily transmitted through direct contact. Contact precautions, gloves, gowns are essential, and thorough cleaning of all surfaces helps prevent environmental contamination. Antibiotic administration for all patients is unnecessary and not recommended.
If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.